in the case of India also, we have various forms of disease surveillance mechanisms, which kind of came in, I think, late 90s, early 2000s, but during the first SARS coronavirus that has come up in China, which also led to the creation of an active set of health disease practices in countries like Taiwan and Southeast Asia, which were afraid of the SARS virus coming into their countries from China, from the early outbreak in early 2000s. Now, healthcare surveillance is important. It's it's a form of manual contact tracing usually. So you do this essentially to identify how the disease has spread from one person to other person. So the only way to do that is actually to find out where a person has been and to go manually backtrace all of his activities and see how he has contracted disease. In case of coronavirus, because it's known that it's airborne and right now is spreading through human contact, so we are trying to trace parts of where an individual has been to and how he probably could have contracted the virus. But there are other scenarios where the virus could be waterborne. And this entire study of how disease spreads was actually coined or started, or one can say evolved post the cholera outbreak in London, Soho, when Dr. John Snow, who's also widely reviewed as the father of epidemiology, used statistics and maps to essentially mark where the people have contracted cholera, to identify that cholera was spreading through water, through the water pumps in London. And by using maps, by using statistics, he has essentially found out that how the disease was spreading, and this kind of became a norm. Later, public health officials started adopting these practices. Epidemiology as a science evolved. So we have epidemiologists who are actively doing disease surveillance for diseases like AIDS, cholera, or even tuberculosis. Now, what we are witnessing in India right now in terms of, say, IT powered, data powered surveillance, which is being used for healthcare response. So if you see the patterns of how the response to the pandemic was not primarily from the healthcare officials, but it's being led by police or it's being led by IT firms. If you look at the Arogya Setu app, it was developed by a few startups who volunteered to build this app. And if you look at the lockdown and manual contact tracing, it's being led by the police. Now, these people are not trained in healthcare response. They only know to hit people. They only know to ensure that people don't move. Basically, it's a form of practice that they evolved for political stability in the country and not necessarily a healthcare response, what an epidemiologist or a doctor would do. In fact, we don't have many epidemiologists. Several states now want to hire a lot of epidemiologists only for a brief period of 6 months or so on. I think Telangana itself is also trying to hire 20 odd epidemiologists to avoid this crisis, during this crisis. Now, so the way the police have essentially looked at contact tracing or essentially to contain these people movement during the lockdown or even pre-lockdown was essentially by using call data records of people who have a history of traveling abroad. Once a lot of people entered India from abroad and were essentially could be a potential carriers of the coronavirus, we did not screen them enough at the airports, or people were actually trying to fake their symptoms by taking paracetamol tablets just to lower their temperatures. And since we weren't testing them hard enough, the police essentially used call data records post the immigration, post they went to their villages, to essentially crack down on them and quarantine them. Now, the usage of call data records to locate an individual is a very policing practice which kind of came out post the post the Bombay attacks of 2008. The Bombay attacks of 2008 were, in its own way, was a crisis which led to a lot of intelligence failures, and and we were unsure at that point of time in December of 2008. We don't know if more attacks were going to happen. We don't know if it will be the only one because of a weak border security through the course, and also the capacity of the police. So you see that the center has pushed for a lot of policing databases and surveillance databases post the crisis, right? So you get something called the central monitoring system, which essentially monitors all telephone communications over Indian telecom infrastructure. Then you get the crime and criminal numbering and tracking system, sorry, crime and criminal networks and tracking systems, which is connecting all police stations, all the FIR records, all the forensics of every police station in the country. Then you get e-prisons project. Then you also get the NAT grid project. So you get a series of surveillance projects that pop up post the Bombay attacks, because that was a crisis point for a national security point of view. But you also see a rise of welfare databases that come up, like Aadhaar, direct benefit transfer. And in 2008 was a crisis scenario in 2 points of time. India went through the Bombay attacks, and you also have the global financial crisis. With the Lehman Brothers crash in the US, the Indian IT sector also went through an economic slump where they had to find new clients, which were the US banks essentially. And what you see is that the Indian IT sector suddenly starts realizing the government of India as a potential client, which requires a lot of IT solutions for surveillance databases. And increasingly, Nandan Nilekani and his band of IT men suddenly start proposing all sorts of solutions to the government, and there are no questions asked. You suddenly get a lot of these databases that have popped up. And you're witnessing a similar pattern right now during the coronavirus, where there is a whole rise of apps across the world. I'm not necessarily saying it's only in India, but across the world, people are pushing some of these technology solutions, surveillance solutions, which are not being led by doctors or healthcare professions, but actually being pushed by IT professionals who have no idea how healthcare response works. Now, any of the infrastructure that you built stays. And that's a problem, because all the infrastructure that was built post the Bombay attacks, for example, the push for the multi-purpose national ID card or the national population register happened post the Bombay attacks, because India wanted to identify everyone in the country just after the Bombay attacks at scale. Even though it's a past decision, it was pushed during the attack. So what happens in crises is people have these solutions which they were trying to push through the governments, and once you have a crisis, they see that nobody will ask questions, so you're just pushing them through. I mean, it could be even say buildings or flyovers or roads, right? So you have a slum and you can't build because people are protesting, but suddenly during a crisis, everyone's out, there's a lockdown happening, you don't know what each individual department is doing. And that's a serious concern, and we need to be really vigilant on this aspect, because emergencies, any form, healthcare, economical or military emergencies, allow the government to take sweeping decisions, and any infrastructure that comes up, whether it's physical infrastructure of buildings or whether it's IT infrastructure or surveillance infrastructure or even economic infrastructure. When I say economic infrastructure, I mean are we building hospitals or are we building something else, graveyards? It depends whatever that we are doing. These things stay back. It's not necessarily built. It may have been built for the crisis, but they stay back. So all the emergent forms of policing and surveillance that you see, whether it's drones that the Karimnagar police was using pre-lockdown, which to catch people who are drinking on the streets in outdoors. Yeah, the usage of call data records by Indian police are becoming a norm, and you don't see that they're taking any orders. To fly a drone, you actually require permissions from the Director General of Civil Aviation, the DGCA. but the police is not taking any permissions. Even for healthcare surveillance or call data records, they were never transparent. You never knew how many surveillance requests they were actually making and if they were justified. Now, you had instances of political surveillance of, say, Andhra Pradesh chief minister being spied upon, or Telangana chief minister being spied upon. So intelligence agencies have always used this infrastructure for political gains. And with the lack of law, with the lack on law on privacy, with the lack of law on even surveillance reforms, you don't know what could happen with all the infrastructure that's being built. Now, the form of discrimination that we are witnessing by the police itself, because police has become the primary enforcement agency instead of healthcare agency for the crisis, is that they tend to treat the rich differently. They tend to treat the socially connected, socially classes which are above, economic classes which are above certain threshold differently compared to the poor people. And it's geographic in nature too. Potentially that people are allowing you to move freely in certain parts of the city compared to other parts of the city and in the country. Now, pandemics are bad, okay? Epidemics and pandemics are bad. If you look at our own history of outbreaks of cholera or the bubonic plague, which led to the creation of the Epidemics Act, there is a lot of stigma. People do not want to be associated with anyone who might have the disease, who might be spreading the disease. And what you're witnessing right now is that there is a lot of misinformation about it as well. And this is being pushed by the existing infrastructure at some levels, which was built by the state to actually provide news, while it's being misused to give misinformation, and nobody's checking them. So any of the infrastructure can be misused. It's not necessarily that surveillance, it's information or data in general, which could be misused. So now the question boils down to is this: what can we do to avoid some of these, to ensure that these any system that's being built up is in checks? We see that when the lockdowns were initiated, the government actually brought in rules under the Epidemics Act. It's a very age-old act. It's an act from the 19th century. It's a British era act. We haven't even put a new act in place post India's independence. Now, it's not hard for the government to actually bring in ordinances on control of data. Because the reason they need to do that is we have seen instances where RWAs, essentially societies, were able to get access to information, a list of people who have been contacted with the virus. And this was being used by certain political parties and certain individuals to spread hate or misinformation. And there is actually a lack of enforcement by the police on this because we do not have a stringent privacy law. Individuals who are being subjected to this misinformation or this harm through information do not have any recourse now. And government departments itself are publishing the details of names of individuals who were essentially in the quarantine zones. And that's not helping any of us. And at the same time, I would want to stress upon some of the infrastructure that's being built to provide food, to provide welfare. So you see that any of the infrastructure that was built, whether it's Aadhaar, DBT infrastructure, which is essentially you get all of your money to your bank accounts and you're not physically being handed over cash. This infrastructure is being used by the central government to provide relief aid, but it's becoming a problem for people to go out actually onto the street to ATMs and to withdraw cash. Now, it clearly shows the problems with this level of infrastructure or relying on this infrastructure. In some ways, AP is doing a good job of actually going door to door and handing over cash, or what Kerala is doing of going door to door and handing over rations instead of relying on IT infrastructure to directly transfer cash, which people may or may not be able to withdraw depending upon if they're living in rural areas, if they have access to ATMs, if they can actually access that cash. Now, there is a push by some of the people, some of these IT people who have built these systems to even further build these databases. And that's dangerous because some of these databases have been known to be misused. In states like Telangana and AP, where some of this data has leaked, we have actually had special investigation teams, but the investigation never really got carried out. This was the issue of the app by the Telugu party called Samagra. Sorry, I forgot the name of the app, but it was a TDP app for political surveillance during elections. Now, states like Telangana have been building 360-degree profile databases for welfare called Samagra Vedika or IPIH, Integrated People Information Hub. The same information was being used for welfare. The same information was being used for policing, for 360-degree policing. But with all of this infrastructure, Telangana was unable to identify the immigrants in the state to actually distribute them rations. Now, that's actually concerning. These databases will never be able to capture all the data. Any number of databases that you build will be not enough. And there is a push even further now to build a lot of healthcare databases to actually identify individuals' health. So that in any future scenario, that if there is a pandemic kind of scenario, if there is a public health crisis, you will have health officials with all the data they need who can solve it. But all of these ideas come out from a very neoliberal free market ideas where the market or essentially private companies are saying that government doesn't has to do any of this. The private sector will do everything for the government, and which is why this push is coming from the private sector. But the main problem is without any actual healthcare infrastructure, without actually distributing food, without actual infrastructure on ground, these ideas of the market to build giant databases of surveillance, which is widely known by a term called surveillance capitalism, which is the private companies are trying to collect data about everybody in the country to profit from it, while the government does not actually benefit from it in any way. Like if the government needs a database, probably they could build it themselves. There is no requirement from the private sector to do it for the government. So crises are important points, important times where things which are being pushed onto the government may not be actually good for the welfare of the people. It could be just economic reasons for some of these people to actually profit for crises. So you have right now hospital chains and healthcare companies who are actually demanding that the government subsidize or fund them instead of the government actually taking over some of operations of some of these hospitals or nationalizing healthcare, for example. So any infrastructure that is coming up in terms of surveillance or in terms of policing or anything that is essentially being used to tell you that this is for your own good need not be and not necessarily be the right thing for the society at large. And we must be really aware of what these systems are, whether it's Arogya Setu, whether it's DBT, whether it's the new social registry people want to propose, or whether it's Telangana trying to use drone policing. So we need to demand that these systems be done in a right way so that discrimination of any form does not happen during the crisis or even post the crisis. We are witnessing a lot of that happening with the lockdown where people are being hit, people's property is being detained, even though they might be going to hospitals with an actual and legitimate reason. And this could be a point where the coronavirus can undo our democratic civil liberties and could easily be the point of rising civil, authoritarian and populist regimes, and it's happening across the world. And we need to be really aware and vigilant about this. Okay, I'll stop it at there and we can take questions.
Yeah, thank you, Mr. Srinivas. You have taken care of varieties of issues which many of us are concerned of. And there are already a couple of questions. One I wanted to begin with, that the Supreme Court of India says that right to privacy is a fundamental right to every citizen in India. And in contrary, you are almost round the clock, 24-hour, under the surveillance of the state through various means. In this context, how do you locate Indians, I mean citizens of the country or civil society, that how do they handle the situations where both the contradictions are together?
Okay, so it's really important to understand that right to privacy, while we have it, it's not absolute. And that's the argument that the government has always taken, that, look, you can't claim privacy as a means to stop everything. True. This is an healthcare emergency. Healthcare emergencies require some sort of solutions which are not necessarily, which are potentially taking away some liberties, not all, some liberties. I'm very categorical in stating that. Now, it's been 3 years. In 2017, the Supreme Court has actually given out a judgment on fundamental right to privacy. And as we all follow common law, judgments are actually law. And people say that there is no right to privacy law or there is no data protection law. That's absurd. We already have a judgment, and judgments are laws under any country which is following the common law. And it's because it's a fundamental right, it's your right and you have to exercise it. Now the state is behaving as though it can do anything that it wants, and it has been doing this for a while now. It's not just necessarily during the healthcare during the corona crisis, but even before that. If you look at the whole push for the data collection for the National Population Register and Census 21, there was a deep mistrust in the government. And precisely so, because they were collecting a lot of data without explaining us. There was no privacy law. There is still no privacy law. They're claiming us we will ensure all the privacy, but they are not putting that on record. And that's a concern. Now, the thing is, liberties are not something which are given or granted to you immediately. These are something which people have to fight for, and that's what several movements, whether it's our own independence movement or whether it's the civil rights movement in the US in the 1960s, all of these, or even the African anti-apartheid movements have taught us is that you have to consistently be vigilant of governments or political or economic interests parties taking over your rights. Now, stating that, as I've always said, the government can actually create that trust in you that whatever data that they're collecting is actually to solve this crisis. But that trust will not come right away. They actually have to pass those laws. They actually have to, even an ordinance, if the parliament's not working, we know. So you don't have to push a law, but you can pass an ordinance. We have seen that post the Supreme Court judgment on Aadhaar in 2018, the government was quick enough to bring multiple ordinance related to Aadhaar, or even in other laws. Whenever the Supreme Court cuts down a law, the government's bringing out an ordinance. But in this case, even with a judgment by the Supreme Court to get a law, the government hasn't done enough. Now, the only way the government can create trust is actually by acting and actually by being very proactive, and they are not doing that. So that leaves that doesn't leave us with many options except for questioning them harder every day. And it's So one can say that hope it's a healthcare crisis. We don't need privacy. It's something we can ignore. I actually disagree that you need both healthcare and privacy. And the reason is this: if you do not have privacy, say you are being marked, your photos are being spread in social media that you are a coronavirus patient, you could actually, you may recover from the virus, but you may not, you may never end up getting a job in future, because they all will, there could be a social sense of stigma associated with you being a carrier of disease, and you being economically or socially distanced by your own friends, family, or the society at large. Privacy is very important for individuals to survive this crisis and also post the crisis. And people have to question that, otherwise it won't be easy.
There are two quick questions related to Arogya Setu application. Tabrez saying Arogya Setu has full permission to access your precise location. Inclusion of privacy much. What about the privacy of individuals? Similarly, Prashant Singh also asking that what guarantees can private citizen derive from the privacy policy of Arogya Setu application? Can you locate on that? Yeah.
So, okay, there are a bunch of these apps that are coming up, contact tracing apps. Arogya Setu is one of them in India, right? I mean, even within India, there are more than 16 or 17 by state governments and other departments. There is a, for a best cited example for these contact tracing apps is the Singapore's Trace Together app. Actually, the Singapore government open sourced the app. Essentially, the application source code is available. You can go check it out on bluetrace.io. It's the domain where they have released the protocol for the app and the source code for it. Now, how do these contact tracing apps work? They essentially are trying to gather data of every other Bluetooth that you have come in touch with. Like if you have a Bluetooth earphones and you have a phone, how your Bluetooth earphones is connected to your phone. If you are walking around from your phone, if the phone can identify all the Bluetooth devices in its range. Now the thing is, if you become positive with coronavirus, the healthcare professionals can then take your phone number and alert the Ministry of Electronics and IT to actually say that, to alert every other phone which has come in contact with your phone that you have become a coronavirus positive, so that they can seek medical health or quarantine themselves. Now, the problem is not actually this. The problem is, even with everyone having the app, the poor people who do not have these apps, whether it's your sabji wala, whether it's a milkman, whenever you go out, who don't even have a smartphone, they won't be alerted. And anyone, and the thing with coronavirus is it doesn't discriminate anyone, right? Everybody who comes in contact gets it. Now, if you ignore the poor people, if you're ignoring manual contact tracing just because you have the Arogya Setu app, that's not going to help. Now, the question is, does the Arogya Setu app, does it even work? To me, it's not a contract tracing app. To me, it's an app to actually understand where the population in this country is. Because of our last census has happened in 2011, the government of India has no idea where the population is and what number of people are there in the country across the region. And with the lockdowns and with the reverse migration of people leaving cities and going back to their villages, the government has no idea where people are and what sort of human activity is happening. And the only way the government can potentially not increase these coronavirus cases is by locking down the country and by reducing human activity. In no means this is going to help in future. You still need that healthcare response. So when people talk about privacy of the app, it's essentially this. It all comes to, I will give my data, but will the application work? And there is no guarantee it will. And even in case if it works, if you give your data away, the question to then ask is, what happens to this data post the crisis? Whether the individual will be given the option to delete the data. does not exist. And the terms and conditions actually say that the government's not responsible for any breach with the data, which is like clearly against the Supreme Court judgment on fundamental right to privacy. So, so in all, that app is of no use, and to me, it's actually a distraction. Instead of talking about healthcare, instead of talking about the poor people not getting enough food, we're probably discussing more about the app, which doesn't work. So I would say that it's the government's push. The reason when I say we're discussing more about it is not us discussing, it's mostly that the government's spending a lot of money in terms of advertisements, in terms of promoting the app, and in terms of forcing everyone to install the app. And anyone who doesn't have that app being excluded by the society at large. Now, that's a problem that I see with the app.
Jyoti Raj Patak has a very important question. Like, how do you see the state is behaving?
How do you see the state is behaving more as a police state than any welfare state? And connecting to Ali, who also adds that, how do you see the civil liberties are being taken away during the entire lockdown period, where citizens have no access to any access as a citizen of the country? So, can you reflect upon that?
Okay, I think there was a question on the role of Supreme Court. Well, I'll add to this now.
Yeah.
So the modification of the Indian state from a welfare state to a police state starts again post the Bombay attacks. You see that there is a decrease. I mean, if you look at the idea of welfare state, it's always been there since 1947. Every time there is a crisis, the state has to ensure that its citizens are not neglected and they're fed properly. So it's been the aspect of the state, right? The state is there to do that exactly. But what you see post 2008 is essentially the private sector taking over some parts of the welfare state, privatizing the welfare state, essentially saying that, oh, you should set up DBT infrastructure. There's a lot of money, taxpayer money that's going out, being scammed by politicians in the name of welfare. The food ration, all the ration shops are fraud. There are duplicate ration cards and all of that. While stating that there were no prosecutions, there is no investigations on who are these people and whether these people should be criminalized for their actions. But what you instead see is that privatize the welfare state so that private sector can ensure that they can ensure that there is no corruption, that there's no guarantee that privatizing it takes away the corruption. The corruption still exists. Instead of 12 kg of rice, you only get 10 kgs, right? The end dealer is still doing that form of corruption, and we haven't eradicated that. Technology does not necessarily brings in social reforms. All it does is it gives you more intelligence, which is not necessarily the right form of intelligence too. So at the same time of the transformation of the welfare state into a private state, because the free market wants it, because private companies are pushing for it in the country, this is also the time when India is like growing at this 8-9 GDP growth rate, GDP growth rate, when you are like trying to create the jobs and you're saying that, oh, India can do a lot of wonders. So the economic agenda takes over the welfare agenda, and essentially the government says that, oh, we don't need to take care of the poor people because we are growing economically. They all can find a job, get a job, and fend for themselves. So that's the more free market thinking that has taken over. While this was happening, the Bombay attacks of 2008 also led to a push towards strengthening the police infrastructure, the surveillance infrastructure. It's not just the surveillance infrastructure that has come post the Bombay attack. You had physical infrastructure that the cops got. So you get these newer vehicles, armored vehicles at airports. You get access to extra guns, special weapons. Then you also get new teams like SWAT teams for each police departments in several cities. Like Hyderabad has this team called Octopus, right? It's special weapons and tactics. Essentially, everybody gets all the gear and equipment. So there was a lot of investment on physical infrastructure too. Now, at the same time, you had this home minister who was very strong, Chidambaram. All of this has happened under Home Minister Chidambaram in 2008 and 2009. He pushed a lot of these so-called reforms. I don't want to call it reforms. That's what they're termed, policing reforms. But what he strengthened is he strengthened the home ministry, he strengthened the police departments. So you see that the home ministry went after a lot of NGOs that were working in the space of civil liberties. So you see that lot of them who were foreign funded suddenly lose all of their FCRA access, and they all crash down, right? Because they're criticizing the Congress government back in power then. So you essentially have this one man who essentially took away all of the civil liberties and gave it back to the cops. And then you have the BJP government, which also politicized uh, the police for their own reasons, their own political reasons. And you have Amit Shah, under Amit Shah, it's if you've seen what happened in Delhi, it's like the Delhi police is almost a militia of the political party and not necessarily a civilian organization anymore. So while all of this is happening, the Indian Supreme Court also, the judiciary also went through its own set of issues, and it's a paper court right now. Like it does not care about anything. It cares more about Arnab Goswami being attacked, a person with Y category security, needs more attention from the Supreme Court. He could have easily approached the High Court, by the way, than people who are stuck in every other city with lockdowns and not getting enough rations, and lakhs of potentially people about to die because of hunger. So as a society, we have transformed, and a lot of this transformation was because of this push, which was done through social media, which is done through misinformation and disinformation, which again is an important aspect, which is targeted because these political parties like BJP were able to get information about a lot of these people through social media. And that's continuing to happen even during the pandemic.
Yeah. There are questions related to the everyday life of people in India, like when the daily activities of the people are under surveillance and how the data is being used. Can you also share some example where the data is being used and the way how citizens can protect their data in order to use maximum technology and an application which is available there?
Okay, so this is an interesting thing. Remember when Hyderabad police said, if you're splitting on the streets, you will be fined. By all fairness, spitting on the street should be made an offense. But the way they were going to find out was use CCTV cameras. So if you're coughing and if you have to spit it out of your mouth, you're probably doing on the street. And it's an Indian tendency that people generally spit on the street. Now, can the cops change social behavior of an entire society by fining them? I don't think so, because we have hundreds of laws. We have always tried to do that, and it never happened. The rather important way to handle this is actually to educate people that how them spitting on the street could actually potentially create spread the virus, because it goes through cough and it goes through bodily fluids that you might be spitting out. Now, we are not focusing on that. At the same time, the data that they're collecting, right, the CCTV data or the fines or any of that they want to collect, we don't know what they're going to do. So you have the scenario where everyone's out of the job, and people, if they are going out of the street to actually get medicines or anything for some urgent requirements, The cops are not inquiring why people are out. They're actually just hitting them first and then asking them questions or seizing their vehicles. So they actually need to inquire and provide them that, but they're not doing it, or they're probably collecting some data, but that is not being used for anything important. But we see a different form of action. If you're on Twitter, you ask them for something, you ask for some help, they are trying to provide it. But then again, that's very selective depending on who you are, whom you tag, where you live, and how responsive the station house officer in that area is. But the data that I see that the police are collecting a lot is primarily activity data through call data records or through purchases data. Telangana also now wants to collect everyone who purchases any medicines related to cough, cold, and fever. Now that's interesting that they want to do this and they want to quarantine people. But the problem is when people are actually going to the hospital saying, I have these symptoms, test me, they're actually not testing people. So with all this data and without any testing, it's of no use. So now this brings the question, what will the government do with this data? When we see that every private company which wants access to data about these patients, the government just sharing it to them, whether it's their x-rays, whether it's their medical data, and saying that they will use AI, build an AI to solve this crisis. I mean, what is an AI? Healthcare ke bina AI is not going to solve anything. You actually need doctors, and without them, all forms of AI or the software or data, nobody can eat it. It won't solve your health. You can't inject it to increase your health. You can't eat it to get your health back. Data is of no use.
There are two concerns. I mean, one, I also have a question like about Zoom itself. I and some of our friends had hundreds of questions in last 1 week that data used through Zoom is not at all, protected. And in fact, even academic activities, people are unable to do it. They're feeling that these data may be taken. But why it's happening? Because there is total surveillance and control on the information which is coming from the outside the country. And can you also inform us that how do you protect such data? I mean, or differentiate the data between confidential, sensitive, and in everyday information which you use in our social life?
So the problem with Zoom is primarily in terms of who can access the call, right? So right now we are accessing this call. We are actually publishing this call. We are streaming it live on Facebook. It's open to anyone. So there is not much of a privacy implication unless we also tell everybody else who's attending the call, who is viewing this call, right? That we are not doing. But Zoom actually knows that when you are actually setting up that call, asking people's information, who is attending and who wants, where they are from. Zoom gets access to a lot of this information and what people are attending, what kind of calls. So it gives away a lot of information about individuals' interest to Zoom. Now, the thing is, even though Zoom is registered in the US, a lot of its servers are based in China. So the question then comes is, will this data be accessible to the Chinese government, who can potentially use it to target Indian citizens from a nation state disinformation, misinformation attack point of view, so that it can destabilize the country? It's quite a concern for the Ministry of Defense or Government of India. But from a very individual point of view, you should be concerned about whether your interest, whether you are attending a call on a certain topic, could be used well when if it sells this data to a private company like a pharmaceutical company or to any other company, the insurance companies, whether they will use this to discriminate you is something that of an individual concern, right? Like that the insurance companies know my behavior habits, and based on what kind of behavior habits I have, they try to put put my medical premiums at a higher rate. That is the issue that for individuals have. It is how it might affect them individually. So we don't know what Zoom does with most of this data. So in those ways, it's a concern. So there are alternative solutions actually. There are open source applications. There is something called Jitsi. For an audience less than 35 people, there's a website called meet.jit.si. Meet.jit.si. Jitsi is as an application very similar to Zoom. It can be used without any registrations. It can be you can use it to stream it to YouTube, and it's open source, so anybody can set up a server on their own for their calls. So you don't essentially have to use Zoom. What you could do is, like, when you go to meet.jitsi, you can actually create a URL link for a session. Like, for say for today's, you could have created meet.jit.si/surveillance reforms or surveillance talk, and you would get that URL reserved for your talk. So that way, it's a interesting application. There is one more open source solution called Big Blue Button, which can be used for schools. If people want, like, there are any schools which can't afford Zoom, but if you want open source solutions, they could use Jitsi, or they could also set up their own Big Blue Button instance. But I'm happy to help set up some of these if anyone wants later.
Thank you so much. We'll have last question from a very small question and very interesting, maybe important as well. That how can you elaborate that surveillance data is being militarized against the citizens? I mean, own citizen, in which way? I mean, can you also elaborate on in this area quickly?
So the thing is, a lot of Indian police practices in terms of surveillance are practices that you see intelligence agencies that have adopted